For our presentation, we chose fungi Candida albicans. For our presentation, the name and description of Candida albicans is it's a species of yeast and a member of the Candida genus. This is part of your normal flora of the human body. It is commonly found in the gastrointestinal tract, oral cavity, and vaginal microbiota. It coexists peacefully with other microorganisms, although it can become pathogenic under certain conditions. Candida albicans is an opportunistic pathogen. This means it typically causes infections in hosts whose immune systems are compromised, or when there is an imbalance of the microbial community. Candida albicans is the most common cause of invasive fungal infections in the human body. This causes infections, especially in people who have pre-existing conditions or are already immunocompromised. These create the perfect conditions for Candida albicans to become pathogenic. Now moving on to a little bit of the history and background of this fungus. The history of Candida albicans dates back to the late 19th century when it was first identified as a pathogen. The genus Candida was formally introduced in 1838 by the French mycologist Pierre Bethold. The specific identification of the fungus as a distinct species merged later on. The first recorded case of an infection was in 1925 by Dr. H. McGowan. McGowan observed this infection and how it took course in a patient who was immunocompromised. Now moving on to the etiology. This pathogen is a part of the normal microbiota of healthy individuals. It commonly resides in areas such as your oral cavity, gastrointestinal tract, and in your vaginal cavity. Under normal circumstances, this fungus is not pathogenic and can coexist peacefully without causing any disease. Lastly, I'm going to talk about preventative measures. The preventative measures include a lot of lifestyle changes and some home remedies. For one of the lifestyle changes that you might want to make is dietary changes. This fungus thrives off of sugar, so reducing your sugar intake and carbohydrates can help cause the fungus to not be able to thrive and become pathogenic. Next, probiotics. Probiotics help keep a natural and healthy balance of bacteria inside of your body and allows the yeast to not become harmful. Lastly, good hygiene. You want to make sure you're keeping every affected area clean, so your mouth, just keeping everything clean. This can help prevent infections that may occur. Thank you.
Starting on slide 6, the cycle of organisms. So the cycle of Candida is characterized by its ability to switch between yeast and the pseudohyphal and sexual reproduction. Along with bioform formation, it contributes to its survival, but this is a significant pathogen to humans. So if you look at image A, that's the yeast cell cycle, and if you look at B, that's the pseudohyphal cells, and then the hyphal growth. Okay, starting on slide 7, this is the portal of entry. And the portal of the entrance for this fungal would be the mucosal surface. This means oral, vaginal, the gastrointestinal, and skin. So medic devices can also create portal of entry for this fungus. So this is a significant pathogen in various clinical settings. So be sure to sterilize all of your medic devices before, or else it could potentially cause a portal of entry. Okay, starting on slide 8, the route of transmission. So this fungus is an endogenous, which means it typically derives from the host's own natural flora. So overgrowth can occur due to many factors, but the spread of this can only happen under specific circumstances. So meaning that the portal of transmission would have to be open for the fungus to grow. Which organ systems are affected? So you have oral candidias, esophageal candidias, gastrointestinal colonization, uveal vaginal candidias, urinary tract, UTI, and then the skin. So with oral thrush, you typically see a production of white patches on the tongue and difficulty swallowing. This is most common in infants. Next, we have the gastrointestinal colonization, and this is an overgrowth of yeast in the stomach, which can cause pain in the stomach as well as diarrhea. This is most likely seen in immune compromised people. Next, you have your urinary tract infection, but this one isn't like your common urinary tract infection. It's produced with yeast. So this is typically seen in patients with like catheters or like other factors that could have a portal of entry for the fungus. Next, we have esophageal candidias, and that is an overgrowth of yeast in the esophagus. And this can cause painful swallowing as well. Usually we see this with HIV and AIDS patients. Next, we have our buval vagina candidias, and this is your yeast infection, your typical yeast infection. Healthy people can have these. It's sometimes driven from antibiotics, hormonal change, pregnancy. So this is kind of typical. Next is our skin infections or skin candidias, and this can be caused from moist areas as well as warm areas that can cause a lot of like moist production. Usually the symptoms of this are red itchy rash, and sometimes it just depends on your environment. If you're okay, starting with slide 10, prevalence and incident. So Candida is one of the most common fungal pathogens worldwide. Some of these people even carry it without even having symptoms, so it can cause a bigger issue for them. So they do see a significant portion of Candidia's cases that can.
On this slide, we'll be talking about morbidity and mortality rates. In morbidity, patients with conditions such as HIV/AIDS, cancer, organ transplants, or those receiving immune supportive therapy are at a high risk for invasive candidas, leading to increased morbidity. In healthcare settings, invasive procedure, prolonged hospital stay, and the use of central nervous catheter can increase the risk of overdeveloping Candida albicans infection, particularly in intensive care unit (ICU) setting. The mortality rate associated with invasive Candida is significant. Studies have reported mortality rates ranging from 20% to 50% among patients with Candida, depending on various factors such as underlying health conditions. Patients with severe comorbidities or those who are critically ill tend to have higher mortality rates. Timing of diagnosis and treatment. If delayed, the diagnosis and intention of appropriate antifungal therapy can lead to worsened outcomes. Antifungal resistance has the emergence of resistant strain of Candida albicans and can complicate treatment and contribute to increased mortality. The signs and symptoms of Candida albicans infection vary depending on the site of infection. Superficial infections such as oral thrush and ovarian Vulvovaginal candidas typically present with localized symptoms like itching, redness, and discharge. Invasive candidas can lead to symptomatic symptoms, especially in impromised individuals. These are some treatment methods like antifungal medication, tropical antifungal. These are often used for skin and genital infections. You have your oral anti-glycid and your capsules, basically little treatment that can help see the treatment. Tetracycline, doxycycline, minocline are some of the machinery of action. Tetracyclines inhibit protein synthesis by binding to the 30th chromosome subunit, preventing the attachment of amniotic strand to the mRNA chromosome complex, inhibiting bacterial growth. Fructosine inhibition basically belongs to the triazole class of antifungals and works by inhibiting an enzyme called lanotyl 14 alpha deoxyribonuclease. This enzyme is crucial in the biosynthesis of ergosterol, which is an essential component for the fungal cell membrane. Ergosterol plays a similar role in fungal as cholesterol does in human cells. It maintains membrane integrity and fraudulent. Dietary modifications. Candida thrives on sugar and refined carbonates. Reducing sugar intake can help starve the yeast and prevent overgrowth. By limiting the availability of sugars, the growth of Candida can be inhibited, allowing the body's immune system and beneficial bacteria to regain control over the microbial population. And taking some probiotics. Probiotics are alive microorganisms that can confer health benefits, particularly in restoring the balance of gut flora. Probiotics such as Lactobacillus strains can help maintain a healthy balance of bacteria in the gut and vaginal flora, which may inhibit the growth of Candida. They can produce substances that lower the pH, making the environment less conducive to yeast overgrowth, and they can also compete with Candida food resources. Other preventative measurements can be a lifestyle and home remedy, keeping a good hygiene and basically like keeping infected area clean and dry can help prevent infections. Keeping up with the dietary changes, some people find relief by reducing sugar and refined carbohydrates as Candida thrive on sugar. Probiotics, these can also help restore the natural balance of bacteria and yeast in the body.